and welcome to this tutorial on Google's Notebook LM for medical practitioners or allied health professionals to help them assist with their learning. It's a really useful piece of software to help make learning much more easy, fun, and insightful. It's not just good for those that struggle to read research papers, which I know we all do. So I'm going to talk about some of the most simple use cases in this video, and click into the description below for a video on some of the more complex use cases which you also may find useful. So let's begin. Okay, so let's get started. So it's a web browser driven software, so please head to a web browser and search in the search bar for Notebook LM. Click on the top link and it will take you to Google's Notebook LM. Click on the Try Notebook LM. And if it's your first time here, it will take you to this page where we click on Create. Now this is where we upload our sources. Sources can come in many formats, from websites to YouTube, from simple text to files that we host and have on our computer. Today's example is going to be using a research article in a PDF format. And it's on the Doha paper on groin pain in athletes. And welcome to the interface. So this interface has sources on the top left, chat in the middle, and studio on the top right. If I maximize my screen, again you'll see sources on the left, chat in the middle, and studio on the right. The studio on the right has an audio overview in the top right. That's what we're going to use first. It also has some notes in the bottom right. This chat feature and function has a search chat bar in the bottom, and this is that paper that we've inserted on the left. So audio overview on the right. Now if I click generate here, it will make me a podcast of my paper. It's the same as if I press audio overview here, so that is the same as pressing that blue generate button, but sometimes it's quite useful to customize, which we will do later. But to start with, we are just going to click generate and let's see what it produces. Now it is generative AI. It will take a couple of minutes. Okay, so let's play.
All right, so we've got a pretty hefty stack of research here all about groin pain in athletes.
Yeah, definitely.
You sent this over to me, and we've got this 2015 paper that summarizes a big meeting of international specialists,
Yes.
plus some of the cutting-edge research that they presented.
Yeah.
And our mission today is to kind of help you understand this tricky area,
Right.
and especially this new system that they created for classifying these injuries.
Yeah, it's really fascinating stuff.
Okay.
I think for a long time there wasn't a common language for groin pain.
Right.
Doctors were using a ton of different terms, which made research and communication really difficult.
Yeah, I noticed that one study used a whopping 33 different diagnostic terms for groin pain.
Oh, wow.
Okay, there it is. So now what we're going to do though is customize it specifically to make it more useful for me in my profession. To do that, I have deleted it over there on the right hand side, and I'm going to customize it now by typing in tailor this towards physiotherapists and their clinical practice, and let's press generate. Okay, so let's play a small excerpt from this.
I bet a lot of us out there can relate to this feeling. You have an athlete walk in with groin pain, and you're like, where do I even begin?
It can be so tricky, right?
Absolutely.
Yeah.
So many different potential causes. And for years, there's been all this lack of a consistent way to even talk about it.
Yeah, I mean, think about all the terms we've used over the years for groin pain in athletes, like sports, hernia, athletic pubalgia, Gilmore's groin, and the list just goes on and on.
Seriously, it's like everyone's speaking a different language, and it makes it so hard to compare research findings or even just have a meaningful conversation with a colleague about a case.
Exactly, and that's where the...
Okay, so the first 37 seconds there, you may not have noticed much of its change towards physio, but yeah, during the next 15 minutes of it, we'll talk about it, how a physiotherapist can use it in their practice. We are now going to talk about the chat function in the middle of the page here. So this big search bar here is what we're going to use to help probe and search and delve into the paper. Think of it as a research assistant, someone that has read the paper in full, and you're asking them questions and they're going to give you some specific, detailed information about it. So let's begin. Question 1. What are the new recommended medical terms? And we click this blue arrow here. Okay, and here is the answer. Question 2. How can a physiotherapist or doctor learn how to differentiate between these entities in a clinic? And then here is the results. And question 3. What equipment do I need to consider having in my clinic to use this paper's findings? And then here is the answer. Okay, so that is the chat function. And what we need to remember about the chat function is that if we were to log out and log back in, this chat would get wiped. It is only a chat, like a conversation doesn't get recorded. So what we need to do is make some notes about it. So let me scroll to the top into my 3 questions, and here's the first one. And what I need to do here is click Save to Note. It will move it to the note section on the right hand side, and it will change and create me a title. I'm going to do that for all 3. And now I've got my notes here from the paper that I've made. There are a few pre-populated kind of questions in the notes. So if you wanted to make an FAQ or a study guide or a brief document or a timeline, we just click on those. Okay, and that is a brief overview of using Notebook LM for medical professionals. And thank you.